Hello everyone, I'm Dr. Parveen. I'm a radiologist. I'm here to answer some of the queries which the students have before choosing radiology as a profession. At the outset, I would like to thank Dr. Arun for giving me this opportunity to share my views on some of the common doubts which the students have before deciding to choose radiodiagnosis as their profession. So there are some questions which Dr. Arun had posed for me to discuss with you all. I did my radiodiagnosis from the esteemed Barnard Institute of Radiology from Madras Medical College. Following my DMRD, I did my DNB radiodiagnosis in Bilroth Hospitals, Chennai, and after which I also completed my FRCR. And and now I'm currently working in Changi General Hospital, Singapore. Fine. The first question which he had asked is, why did I choose radiodiagnosis? It was basically a personal choice. Radiodiagnosis had certain aura at that time. It was the most sought after specialty in entrance examinations, be it masters or DNB postgraduate specialties, and also people felt that it is a very cooler field, and so I thought, okay, it's a very fascinating field where you interpret images. I was certainly drawn towards it, and let me tell you one thing: it is not as cool as people presume. It is demanding, and it has its own challenges. Well, moving on to the next question, my views on DNB radiodiagnosis. Well, DNB and masters in radiodiagnosis doesn't really have much of a difference in the way of training. It's only in the way the students are examined at the end of their training that differs. Let me explain it to you. So whether you choose a college to do your masters or any hospital where you get to do your DNB radiodiagnosis, you are going to interpret images. You're going to get trained yourself in doing ultrasounds, reporting CT and MRIs, and of course image guided interventions. Everything is similar. So it's only the way the examinations are being conducted that differs in DNB and MD radiodiagnosis. So in DNB radiodiagnosis, basically you give your examination in a different hospital, in a different state, and where you don't have any internal examiners. So all the examiners are basically from other colleges. So you're totally in a different environment when you give your exams, whereas that is not the scenario when it comes to masters. Other than that, there is basically not much of a difference between a person who does a master's MD radiodiagnosis or a diploma in national board DNB radiodiagnosis. The amount of knowledge that you gain, it's just the same. And so how do you choose the colleges to do the radiodiagnosis? Basically, as it goes with any other specialty, you look for the college, whether it has got a proper infrastructure, which a structured teaching program, all that. And then specifically to radiology, you would look for what are all the imaging modalities they have. So whether the department is equipped with the basic things, the ultrasound, CT, MRI, at least a 1.5 Tesla MRI, because it does make a difference. For example, a college that has a 0.2 Tesla MR and a college that has a 1.5 Tesla MR, there are certain studies which can be perform very well in 1.5 Tesla MRI, which some certain studies cannot be done in a 0.2 Tesla MR. So there are certain difference with the amount of or the technical advancements that are there. So at least a basic level of imaging modality should be there in the department. So if you take a college with for example the higher volume of cases, you get to see more number of imaging choices that you have. like you will be more familiar with the newer techniques, and for example cardiac imaging, or spectroscopy, DTI, and certain other specialized techniques that are being done in some of the institutes, that you will become more familiarized with them. So there are certain advantages of choosing those colleges with those brand names, or colleges that are more popular, which they have all these imaging technology advances. So when you do your training, you would be familiar, and you would basically have an experience in reporting those things. So in that way, it would be very useful if you would choose or select a college which has got all the needed imaging modalities that are there. And of course, if possible, you can visit the college, you can visit the department to see what all they have. And it will be really great if you know someone and you can talk to them, as any seniors who currently pursuing their radiology training there. So because it will be good to know firsthand whether what kind of teaching program they have, and what all imaging modalities that you would get exposed to. And so in that way, it would be very useful to know what the department has before you join. Having said that, I know some of my seniors, when they studied radiology in some of the colleges, they did not have even an MRI, but now they are an expert in reporting MR, because they took the initiative, and they learned outside the college also, which means they took an effort to learn those imaging modalities that were not available in the college at the time of their training. So they made an effort to study or to learn that from other hospitals or other colleges. As an observer, they went and learned, and it's always the onus is on you to learn the newer techniques and things, and update yourself. How to proceed after taking an MD radiology? Well, you have to basically plan your future, what you want to know. So it will take some time for you to get oriented to the specialty, what's going on in the department, what all work is being done, be it ultrasound, Doppler, how you perform, getting to do the ultrasounds and Dopplers properly, or reporting the CT and MRI, learning the basics. So it will take at least a year for you to get familiarized with all the imaging modalities and learn how to interpret them and what's the workflow. So once you get the hang of what's going on in the department, then you can always begin to understand what you are interested in. And then see, if you want to go abroad, you can always do an FRCR, so you can start your preparation in that way. Or if you want to subspecialize, you can apply for some fellowships, because in radiology we basically learn from head to toe. So you can subspecialize yourself, like for example, you can do only neuroradiology, or breast imaging, or cardiac imaging, or musculoskeletal imaging fellowship. So all this you can do after you complete your master, so you can have an idea of what to do. So why I'm telling all this, because if you want to do a fellowship, it's good that you have some publications, or you channelize your interest in writing paper for journals, and presenting in various conferences. And so there are a lot of radiology conferences that are being held. For example, in Tamil Nadu, in Chennai, there are very many conferences that are being held by the IRA, as well as individually by each and every college. So you get to attend many radiology conferences. So make sure that you present a poster or a paper. You would definitely be doing a dissertation if you're doing a master's. So you can always present that dissertation, or you can even publish your dissertation in some of the journals, so you can work towards it. So make the best use of the time that you are in the department, because that's the period where you get to see a wide variety of cases under the guidance of your professors, your consultants, and your seniors. So it's a time where you make mistakes and learn. And basically what you need to understand is the approach. How do we interpret the observation skills? You have to hone your observational skills and not to miss any findings, and how to correlate and give a proper diagnosis, and to think of relevant differentials. So you work on all this when you are doing your radiology residency training. And apart from that, you also focus on presenting papers or doing posters in other radiology conferences, which will definitely up your CV. Now, how do you do an FRCR? FRCR is nothing but fellowship in Royal College of your fellow in Royal College of Radiology. So basically this is a 3-step process. So the first step is you do a written exam in physics and anatomy. So for this, there is no minimum clinical requirement of training, minimum radiology training that is required. So I would advise probably after a year, when you have done your physics and anatomy as part of your MD or DNB examinations, you can take on this FRCR module. Yeah, so this FRCR preparation starts even when you are in radiology training. So you don't have to wait until you complete your radiology training to do an FRCR. And then once you finish your first module, then they require a minimum of 24 months or 2 years of training to do your the second module, wherein you have MCQ examination in 6 different systems. And then final exam would be a viva, where you will have to present cases and answer rapid reportings and long cases which are to be done. And this would be at the end of 3 years. So all these details are given in the website of Royal College of Radiologists. Every single step of how to apply, how to prepare, all these are given in detail in their website. Basically, FRCR would help you to work abroad, or it will be valuable in your CV when you apply for fellowships abroad, or even in within India. So there are also many other examinations that are available other than FRCR. Now recently EDIR, European Diploma in Radiology examination is coming up, and there are many radiologists who take up that exam. These exams basically widen your knowledge, and it gives you a different approach to report and help you in your day-to-day practice. The pay scale of DNB and Masters in Radiodiagnosis in India and other countries. Well, of course, in India there is no particular difference in pay scale between MD radiodiagnosis and a person with a DNP radiodiagnosis. It is pretty much similar. Abroad, of course, abroad our MD or DNB radiodiagnosis is not recognized. So it's only the FRCR when you have it would be recognized. So they basically don't accept our Indian radiology training. So of course you can do a fellowship, but you cannot really for example, in Middle Eastern countries, it is recognized. Your masters or DNB radiology training is recognized for you to work as a consultant there. But if you're planning to go to US, then definitely they would require you to do their radiology training. But if you're going to do a fellowship, that is not required. You might have to do only an MLE, and then you can directly do a fellowship in radiology. In UK, FRCR is required, and in Australia again our degree is not recognized, so you have to do a FRCR. And in Singapore again only FRCR. With that you can practice in Singapore. Our Indian radiology degree is not recognized, unfortunately. So if you have to, in some places, if you have to work as a consultant, they might require you to do their own radiology training program again. Well, so the pay scale completely differs in other countries. but that is not depending on your master or DNB radiology degree. That's what I mean. Okay, fine. So last but not the least, the most awaited question: artificial intelligence. Is it going to replace the radiologist job? Well, artificial intelligence, it's a deep learning algorithm, or the machine learning program, which has come up in the recent times, and it has gained wide attention. There are a lot of research going on in this field of artificial intelligence, how it is useful in the field of radiology, and there are many debates, and there's not a single conference, radiology conference, without the session on artificial intelligence, and various forums discussing whether it's a friend or a foe to radiologists. Well, it's very difficult to say at this moment whether we'll be out of job in the future. But as of now, what we are trying to understand from the various researches that's going on is artificial intelligence is something that is, basically they are trying to simulate the neural network of humans. So deep learning program, it's an algorithm, it's a subspect of machine learning. So wherein the machine tries to do all the functions of a human, like it tries to analyze, process, so the speech, the voice recognition, speech recognition, understanding. So it encompasses all these things, and then try to analyze the images and gives you a report. So basically what they do is they feed in data from, for example, if a machine is trained to identify lung nodules, so there will be various data sets of images that would have been fed, and the machine would have been trained from that, which is like particular labeled imaging data sets from thousands of images. The machine would be trained from that, and then there are certain complex physics involved. So what happens is, basically the machine will identify all the lung nodules, or it might help you to identify fracture. It has already been in use in diagnosing cancer detection in mammogram. Nowadays even some brain tumors, it has been trained to diagnose. So basically it is trying to do a job of a radiologist. Yeah, that is there. But what's happening is, it is still research is going on, which means there are certain things which the machine cannot do. For example, the radiologist's job is not just interpreting images and generating a report. So we also take into consideration the patient as a whole. So you go through the patient's previous images, the past medical history, you discuss with the clinician, and then you arrive at a diagnosis from whatever imaging findings that you have. So it is the clinical decision or the judgment. So it's not it's not just that comes from these set of images are there, these permutation combination equals this diagnosis. It's always not like that. You use your clinical judgment not just from the radiology training, you also use your undergraduate medicine. So the basic foundation is there for you to make such decision. So you sometimes that this particular diagnosis, it can be a mimic, it can be benign. So you have that reasoning out, so that logical thinking is there. So all this comes with experience, which the machine might take some time for it to reach to that particular level. It is being said that nowadays some of the image-based algorithms used in artificial intelligence surpasses human knowledge in detecting the pathologies or the conditions that it has been trained to. But still, radiologist's role cannot be denied in the hospital and the patients at care, which means the radiologist still needs to be there to lead the multidisciplinary team meetings, or to discuss with your radiology colleagues, and of course to do image guided interventions. Radiologists are needed. and there's always this looming medico-legal issues, so you have to keep in mind the legal and ethical issues involved. For example, the AI is the artificial intelligence. When we use that to interpret a particular imaging modality, say a CT or MR, and it misdiagnoses a condition and it causes harm to the patient, then who would be accountable, or who is responsible for that particular error? Whom do you account for? Is it the physician, the hospital, or the vendor, or the data scientist who developed the algorithm? Who will be blamed? So the radiologist, nowadays what is coming up with various debates is that the radiologist and the artificial intelligence go hand in hand as a collective intelligence or augmented intelligence, wherein the artificial intelligence does certain automated jobs, so it will make your job easier. Certain mundane tasks like these comparing the size of the nodules with the previous imaging, or measuring the lymph node size in oncology staging. So all that will be taken care of by the artificial intelligence, so that you can concentrate on doing other work. Like for example, not everything would be obviously detected by the AI. So there are certain conditions for which the radiologists are definitely required, like certain rare diseases or certain other pathologies which you will have to identify, so you will do that. So they say that the artificial intelligence is going to improve the diagnostic accuracy and increase the efficiency of the work output. Of course, there are also discussions that once the AI comes up, obviously it can do more number of imaging, it can do more number of reporting than a radiologist, so maybe it can lead to reduction of manpower. But I think it is still very early to comment on it, and it will take many more years for that to happen. For the AI to completely replace a radiologist, it's definitely going to take many years for that to happen. And it's like they say the radiology and the artificial intelligence will have to adapt and enhance our radiology profession with the new advancing technologies. And there are still a lot of research going on how best we can implement the artificial intelligence in our day-to-day practice. So it is still very early to say that we will be out of jobs. So it's certainly going to be a very different practice of radiology in the future. But as of now, rest assured, we are not going to run out of jobs. And so it is going to be an augmentative or a collective intelligence along with artificial intelligence, if at all it's going to be implemented in our day-to-day practice. So don't be worried about that. You can definitely go ahead and take radiology as your profession. And so radiology is a field where newer technologies and advances will keep coming up. It's up to us to embrace it and use it in a more effective way, because it's always ultimately it is the patient care which is first, which is very important. So yeah. And finally, advice for doctors pursuing radiodiagnosis as their career. Well, I don't have any specific advice to you all. I think because you are in a stage where you know what exactly you want to do, and whatever specialty that you're going to choose, kindly put in all your hard work and give your level best to shine in that field. I'm sure you will all do. And there are a lot of prospects in radiology. Forget about the artificial intelligence. You can still shine in this field. You can subspecialize yourself. Nowadays subspecialty is becoming the norm. In India it is still catching up, but abroad it's always subspec. So you have in the radiology department, you have neuroradiologist, musculoskeletal radiologist, body imaging person. So everything is like subspecialized. So yeah, you can do that kind of a subspecialty training. And you can always do interventional radiology, which is another fascinating and a very interesting field. so that will always have a lot of options. And yeah, so you can do an interventional radiology, you can do interventional neuroradiology or hepatobiliary. So there are very many options for you to branch out after you complete your initial radiology training. And you can always choose to work abroad as well. And yeah, you can do FRCR, or you can write MLE, and you can train yourself in US in any of the other subspecs in radiology. So the options are a lot. So all the best, make a wise decision, and whatever that you choose, if you're happy and satisfied with what you choose, you'll definitely shine in that, and you will you will do well. So all the best for you all. And if there are any queries, you can reach out to me at my email ID, drspjkmc@gmail.com. Thank you very much. Thank you.